Oh, hello. I didn't see you there. But I'm glad you're here. Today I want to welcome you to another exciting segment. Today we're going to dive into the wonders that is women's health. More specifically, polycystic ovary syndrome. Can you say polycystic ovary syndrome? That's okay. You can just say PCOS for short. Now at this point I want to advise you to remove any small children from the room, for this information could be quite sensitive and graphic to smaller crowds. Oh, good, you're still here. Which means if you're still watching this, you might have PCOS, and that's okay. Because we're going to be talking about signs and symptoms and treatments that might be right for you. So at this point you're probably wondering, well, what is PCOS? Well, PCOS is a hormone disorder that causes enlarged ovaries and cyst formation around the outer edge. Now they say about 1 in 10 females are diagnosed with PCOS. Very interesting statistic. More importantly, they say about 70% or so go undiagnosed. Now, although this condition is serious, it is treatable. So let's just dive right in.
Who is at risk for developing PCOS? The exact causes of PCOS are not known at this time. However, genetics likely play a large role in its development. PCOS is most commonly reported in women who have high levels of androgen hormones, or testosterone, in their body. Also, women with a higher body mass index or family history of PCOS are also at a higher risk. Lifestyle has also been shown to contribute to the development of PCOS. Lastly, women who smoke or who lead a sedentary lifestyle are at a higher risk of developing PCOS.
This is what the female anatomy looks like without PCOS. This is what the female anatomy looks like with PCOS. The fluid-filled sacs you see in the ovaries of this image are called cysts. They can form on one or both ovaries and can cause the ovaries to drastically change in size and can produce an increased amount of estrogen. Women with PCOS develop cysts because there are complications in the body and an imbalance of endocrine hormones. To understand this further, let's look into the menstrual cycle. After bleeding and shedding of the endometrium occurs, blood levels of the ovarian hormones are low. The endocrine gland called the hypothalamus is signaled to secrete gonadotropin-releasing hormone. This in turn signals another endocrine gland called the anterior pituitary to release the follicle-stimulating hormone, or FSH. FSH causes the development of the ovarian Graafian follicles. These follicles hold the immature eggs and produce the female sex hormone, estrogen. As the menstrual cycle continues, the anterior pituitary gland releases another hormone called luteinizing hormone, or LH. When there is a surge in LH, the immature egg is supposed to be released from the follicle for possible fertilization, and the cycle carries on. When a woman has PCOS, there is an imbalance in hormones, and the follicles can have issues with releasing the eggs. If the follicles do not release the eggs, the follicles can keep growing in size and eventually form cysts in the ovaries. These cysts are called follicular cysts. If the follicle is able to release the egg, it turns into its next role as something called the corpus luteum. But when a woman has PCOS, the follicle reseals and fluid begins to build up. This can cause and grow corpus luteum cysts. Here is what an ovary can look like with polycystic ovarian syndrome in an ultrasound. Now let's talk about what can cause this syndrome. The exact causes of PCOS is still unknown, but studies have found many factors that may contribute to the syndrome. For example, weakened immune systems, bad dietary choices, genetics, and complications with how the brain or pituitary gland communicates with ovaries have been linked to an increased risk of developing PCOS. All of these factors lead to the main contributor of PCOS, which is an imbalance of endocrine hormones. These endocrine hormones include an increase in estrogen, testosterone, and LH, and a decrease in FSH. PCOS can then be transmitted genetically as an autosomal dominant or X-linked dominant trait. Due to the different ways the body can respond to the syndrome, you may experience certain signs and symptoms.
Over half the PCOS community will experience weight gain and obesity that can be hard to manage. Changes in hormones can lead to acne problems as well as other skin issues like skin tags and dark patches. Unwanted hair growth or excessive hair can appear on unusual places including arms, back, chest, abdomen, and face. Some women experience irregular periods, so always be prepared. A few other symptoms that are common are headache, pelvic pain, and fatigue. Hair loss might be a problem, and even depression. Difficulty sleeping affects women with PCOS. Insomnia is one of the issues they struggle with. Mood changes are usually present, and PCOS is one of the leading causes of infertility.
You may be asking yourself, what exactly are the complications of PCOS? Having PCOS can increase your risk of complications during pregnancy. These would include, but are not limited to, miscarriage, high blood pressure induced by the pregnancy, as well as preeclampsia, gestational diabetes, and premature birth. Other health complications besides fertility issues that have been linked to PCOS include risk for developing insulin resistance, prediabetes, diabetes, abnormal cholesterol and triglyceride levels, cardiovascular disease, stroke, obesity, sleep apnea, and cancers such as breast, endometrial, and ovarian cancer.
As of right now, there is no cure for PCOS, but you can manage the symptoms of PCOS. The treatment for PCOS depends on what symptoms are of greatest concern to the woman. Here are some treatment options that might be right for you. Birth control. For women who don't want to get pregnant, birth control can make your menstrual cycle become more regular, lower your risk of endometrial cancer, and help reduce acne and extra hair on the face and body. Anti-androgen medications. These block the effects of androgens and can help reduce scalp hair loss, facial and body hair growth, and acne. Metformin, used to treat type 2 diabetes, it may help some women with PCOS symptoms. Here are some treatment options for PCOS if you are looking to become pregnant. Losing weight. If you are overweight or obese, losing weight through a healthy eating and regular physical activity can help make your menstrual cycle become more regular and improve your fertility. Medications. After ruling out all other causes of infertility, your doctor might prescribe you a medicine to help you ovulate. In vitro fertilization. IVF may be an option if medication does not work. In IVF, your egg is fertilized with your partner's sperm in a laboratory and then placed in your uterus to implant and develop. Surgery. Surgery may be an option, usually if the other options do not work. Talk to your local physician today and see what's right for you.
Since PCOS is one of the leading causes of infertility, there are many treatments targeted to helping women with this. Fortunately, many are successful with these treatments and are able to get pregnant.
There you go. Congratulations. Mom, he's got your eyes.
Are you looking for support with PCOS? You're not alone. Many groups are available and can help provide a level of emotional validation and information. Groups may address issues such as diet and nutrition, fitness, infertility, and depression. You can find a group locally through a hospital or online through organizations such as PCOS Challenge or the PCOS Awareness Association. There are also other ways to get involved and raise awareness and funds to help in the fight against PCOS. PCOS Challenge hosts 5K runs and walks across the country, and the National Institute of Health runs clinical trials and research studies for women who qualify. Blogs and online videos can also help provide emotional support and information in an interactive way. Soul Sisters, cysters.com, is one blog that provides stories and struggles of women with PCOS.
Want more information or are interested in joining a support group? Take a look at some of these sources. PCOS Challenge, Androgen Excess and PCOS Society, American Association of Clinical Endocrinologists, PCOS Awareness Association, and Soul Sisters.
Well, we hope you enjoyed this wonderful segment and learned a little bit about PCOS. But unfortunately, that's all we have for you today. So until next time, I will see you later. Peace out. Oh, and Dr. Lyons, if you're watching this right now,